Now, you may have heard that a review has been ordered into aged care after the Rosewood Rest Home became our deadliest cluster. 6 of the 9 people who have died in New Zealand from coronavirus have been residents at the Christchurch Rest Home. That includes 3 men in their 80s and 90s being cared for at Burwood Hospital. The Director General of Health says the review will be carried out in conjunction with the Aged Care Association. The CEO of the association, Simon Wallace, joins me now. Good evening, Simon. This is, it's terrible news today, isn't it?
Yes, Lisa, and first and foremost, our thoughts need to go out to Rosewood. They need to go to the residents, the families, the staff and the owners of Rosewood. This is a tragic situation. It's really difficult for everybody involved. And perhaps the saddest thing of all is that the families of those that have died were just not able to be with them in the last days of their life. So let's just have a thought for those people.
Do you agree with that position, Simon, that relatives should not be allowed in?
Well, I know that the Director General commented about that in his press conference today, and I think that's very welcoming that he's going to look at that. I know that across all our rest homes that we have had very, very strict visitor protocols right since the beginning of March, but we have allowed family members to visit loved ones on compassionate grounds at end of life or palliative, when someone is palliative. And that has been done with respect to all the strict hygiene regulations that have been in place. So we've certainly welcomed today what the Director General has said about that in the interests of families.
Has anyone been allowed in to visit a COVID patient in their final days?
I'm not aware. I think you're referring to Burwood, Lisa, and the Rosewood residents who were transferred from the dementia unit at Rosewood to Burwood. I'm not aware that any of the family members were able to see their loved ones in Burwood.
That must be pretty hard for staff dealing with deaths in rest homes, not just from COVID, but generally, to be the ones that are there when the families cannot be there. That must be a lot of pressure and emotional strain.
It's an emotional strain for everybody, and the DHB staff in Burwood have been looking after those residents, but also there have been the staff that were stood down or were required to self-isolate and stand down from Rosewood, who were like the family to those residents, and they haven't been able to have that contact either. So, there's a lot of people affected by this.
The Director General today has ordered a review of aged care. What do you want to come from that?
So my understanding of the review that the Director General announced today was to look at the 6 facilities where there have been COVID-19 outbreaks, and look at what's worked well and what hasn't worked so well, and then look at another 6 facilities where there haven't been outbreaks. So look, we welcome that work, and we will participate in that work, and we will facilitate that work. We think that that's the right thing to be doing here. But I think there's also some perspective on this, that there are more than 650 rest homes around New Zealand looking with 35,000 residents. So this is less than 1% of sites, and it's a very small number of residents that have been affected. And I think that just demonstrates the great job that we have been doing, and the job that we've been doing here in New Zealand by everybody. This has not been the situation overseas.
The thing is, though, the Director General made some comments in respect of what he described as deficiencies in the sector. What was he referring to when he made those comments?
I can only think that he was referring to Rosewood when he made those comments, Lisa, and I think that was unfortunate because it created a situation that it might have created a perception that there were deficiencies across the whole industry. And as I've indicated to you, we're only talking about 6 facilities here. So That was unfortunate, but we're doing a really good job. And I think the other thing is that we are a professionally run industry by registered nurses and by highly trained and qualified caregivers. We are looking after very vulnerable, frail and elderly people, and the sector is in good heart and doing a really good job.
Can you give us an idea of what Alert Level 3 might look like in a rest home, what that would mean for families and for the residents?
I would think, Lisa, that our sector would be one of the last to come out of any lockdown. The rest of New Zealand may come out of a lockdown before us, but I would think we would be the last to come out of a lockdown. And no, I don't know what Level 3 will look like at this point.
Realistically, how long do you think it will be before people can visit their loved ones in a rest home? The rest of the year?
Oh, look, I would hope it's not that long. I mean, we take direction from the government and the Ministry of Health, and we're working really closely with the Ministry of Health on this. I don't think anybody can put a time frame on it. And, the Prime Minister hasn't done that either. So I don't think that I can put a time frame on that.
But if the rest of the country comes out of lockdown on the 22nd of the month, is it your belief that that basically won't apply to rest homes? You won't be able to drop down a level?
Well, as I think you've seen in other jurisdictions, certainly in the UK, where over 70s have been told to stay at home for 12 weeks, it's not just about old people in rest homes. It's about our older population in general who are the most vulnerable. So look, I can't foretell what will happen, but what I'm saying is that I think it will be longer for our sector.
What else do you need there? Do you need more testing in your sector?
We need a range. We need an armour, if you like, of initiatives to fight this virus. It's having adequate PPE. It's having good infection prevention control. It's putting our new residents into 14 days isolation. And yes, testing is absolutely part of that. So it's part of a suite of measures. We have
What do you mean by that, Simon? Sorry to interrupt, but are you talking about testing everybody coming into a rest home facility, regardless of whether they're showing symptoms or not, including staff, or what would you like to see in terms of levels of testing?
So we would like, firstly, in regard to residents, and I'll be clear about this, new admissions, so new residents before they come into a rest home, whether they are being discharged from a public hospital or from the community, we are asking of the ministry for all those people to be COVID-19 tested. And if they are positive, we will not take them. If they are negative, we will still put them in isolation for 14 days. And we are also calling for frontline aged care workers, for nurses and our caregivers to be tested as well.
Randomly tested, regardless of symptoms.
I'm not a clinician, and I don't want to pretend to be a clinician. But I think it's important that our staff are also tested. And we heard the Director General today talk about a lower threshold for testing. We welcome that, but there is some ambiguity around what he means about that with respect to both residents and our workers. But we're saying test our frontline workers as well. It may be that those workers are tested in areas where there have been clusters or areas where there are more COVID cases. I'm not a clinician, but that would need to be worked through.
You mentioned PPE, so personal protective equipment. Are rest homes, do they have enough of it? I'm still unclear.
Well, they didn't at the beginning of March until we agitated, and I think I spoke to you on the 3rd of March about this. And we agitated throughout the first couple of weeks of March to get PPE for our rest homes. I have to say it was quite an effort, and it took a number of weeks for that equipment to arrive. What I can say now is that our rest homes have very good access to PPE. albeit there are one or two pockets in DHB areas where that's not the case, and we're working on that. But
where are those pockets?
I don't have that to hand, sorry. Our members tell us. I'm sorry I don't have that information to hand, Lisa, but there are one or two areas where there are still issues, but largely it's very good now, and they have the equipment that they need.
We're several weeks into this, so should there be any pockets that don't have enough of this equipment?
No, there shouldn't, and I think those questions need to still be asked of the Ministry and the DHBs.
Are you asking those questions? I know you've had conversations with Dr. Bloomfield and overnight.
In terms of the PPE, yes, we're talking to them daily about that, and me and my team are talking to them daily about that and identifying the areas where there are still problems.
Really appreciate your time this evening. That is Simon Wallace, who's from the Aged Care Association.